So our project is focusing on questions of gender-based violence against migrant and refugee women. And our idea, the main idea, is to see how and why these women can become vulnerable to gender-based violence during migration and when they arrive in host countries. And what makes them vulnerable, whether it's in terms of law, policy, social or economic situations, all of the factors which can make these women particularly vulnerable to violence. And to do that within a comparative perspective, looking at different countries, which enables us to see, for example, if different legal frameworks or different kinds of provision might help on making these women less vulnerable or giving them better access to services, because we're looking at how they can access, for example, services for survivors of violence or victims of violence, or medical services too, because we know, I mean, from previous research, that gender-based violence is, a huge problem for women's health. So looking at the health, the mental and physical health implications of that as well. So that's what our project is about in general. And we have a consortium, a group of researchers, mainly based in Europe, so looking at different countries within the European Union, which is interesting because it enables us to have a very comparative framework. All the countries within the European Union have, well, some elements of similarity because of the EU frameworks. But then we also wanted to compare with some countries outside of Europe. For example, we're looking at Canada, and we have a team of researchers in Canada, which is particularly interesting because they have, for example, their private sponsorship program for refugees, which is quite different from what happens in Europe. And then that can show us, how does that kind of program or that kind of policy have an impact on the experiences of the people, the women who are arriving. Israel has some very particular problems, as well as the the ongoing being in conflict. They have what's become a very strict and restrictive and repressive policy with regard to migrants and asylum seekers. They're particularly African asylum seekers and refugees who are arriving in Israel. There are a lot of problems. So we thought that will also be can also be an interesting case study. We've tried to create, I mean, the first stage of the research was trying to create a common framework and for doing the research, so that we could bring out the comparison. So each country, we did a basic review of all the policies which were relevant and the situation of migrants and refugees, the situation with regard to policies on gender-based violence, so that we can create a comparative framework within which we'll be able to do research which, so yes, of course, there are differences in the way we're actually going to do the research, but all of us, I think, we're working closely, for example, with NGOs, working in migrant shelters, working in some countries where it's relevant, we're working at border, in France, for example, and in Austria, we're working in situations of border control where, which can be sites of violence, which can be where women who have been victims of violence might, try and access services. So there are differences, but we're trying to create at least a basic context where we're doing the same thing. And we're all going to be interviewing, first of all, in the first stages, interviewing policymakers, but also interviewing NGOs who are working with migrants and refugees, and then actually going into centres or places where these women are living and spending time there, doing observation and doing qualitative interviews with them.
Okay, so you're mixing like the institutional point of view and also the person's, the individual's point of view.
It was very important to have the individual's point of view and actually, to go and speak to women, and because we want to see, what could make them vulnerable, but what also are their strategies, because, they're not just people who are victims of violence. They have strategies, they have ways of, responding, and I think that's very important to talk about that too, and to underline that as well. lots of debates in our group. First of all, whether we should look at women, because we're looking at gender-based violence. So
Yeah.
you know, there's the question: do we look at men as well? And so we've decided, and we had a big debate. You know, what about trans? Because there's lots also violence against
Yes,
trans
absolutely.
people, trans women. So we decided to try and make it coherent, to think about women and anyone who identifies as a woman, because of course there is a whole issue of violence against men and violence against LGBT people, but we wanted to have a focus, and we thought that actually in terms of gender-based violence, women are, I wouldn't say a group, because there are so many differences within the group, but they're a group. There are women do experience a lot of violence. So that was that's our focus. But within that, we want to recognise clearly there's a whole load of intersectionality depending on lots and lots of characteristics. So nationality, where these women are coming from, their religion. Because especially within European context, but in lots of contexts, but in Europe we can talk about the problem of Islamophobia, for example, which has an impact. So religion can have an impact, their age, their social class, all of these things. And we need to make sure that, as well as considering the institutional and the kind of structural forms of violence, we want to take into account the way that all of those categorizations can also impact on women's experiences. I think it's one of those things that it's a subject, that gender-based violence, that sadly mainly women are working on that subject.
On that
so
field, yeah.
In that field, not that we're trying to exclude men or the way we're working. Well, so far, as I said, before COVID, we were able to meet. So we've had some team meetings where we were all able to get together, and those we really devoted to, as I said, preparing these kind of country, what we needed to consider for each country to have to work within our team to get the data to give this.
And you published, I mean, those reports, they're available online on your website.
Which are online on the website. So we did these country reports for each country, which are on our website. And we've also worked on developing the theoretical concept. So working like, what is vulnerability or precariousness, what these concepts, what does gender-based violence mean? What would that category women? So we've spent a lot of time as an international team discussing all of that, and also producing we've got basic interview guides, which we'll all be using with adaptations and translations. And then in terms of the actual field research in France, in our context, and all the teams are doing this, we'll be identifying places where we want to work, centers, or for example, one of our team members has already been working in zone d'attente detention centers at the border, doing interviews there. So we're working with specific sites where, and we will be doing more research. We were just starting it when COVID, which was also a challenge.
I guess.
But because migrants, they're already refugees, migrants, they're already vulnerable populations. And clearly the COVID pandemic has had a big impact on them in terms of not accessing services, not having support, being even more confined in certain circumstances.
Isolated,
and isolated. But for us as researchers, we clearly couldn't have access to the sites that we were planning to go to do interviews. So hopefully as soon as that's possible again, then we'll be going and doing the real field research and the interviewing and talking to women there. I think, one of the things we've found across all of the countries is the fact that migration policies are clearly one of the ways that women do become vulnerable, because of their problematic not having legal status is a huge problem, politics of exclusion at borders or within a country. And what's also interesting that we found looking across the country reports, something which we picked out and which we're working on, is the way in which discourses, national, political or media discourses around gender and around migration make it hard to talk about some of the issues in a really useful way. For example, in many of the European and other countries too, when as soon as we start talking about gender-based violence and migration, then all the political discourse is about forced marriage or about female genital mutilation or about, and so we have these kind of culturalist assumptions which come in, and which means that other, you know, perhaps more important or greater problems are being neglected. So that's something which is kind of a common finding, which is interesting, and which we're working on, looking at, for example, the ways, you know, the political framing of these issues. So I think that's very interesting.